We're going to get started. Thank you so much for joining us today for our Ask the Experts presentation. My name is Kim Crable, and I'm one of Hospice of Southern Maine's 2 community liaisons. In our Ask the Experts webinar series, your hospice questions are answered directly by our experts. Our earlier Ask the Experts presentations are available for viewing on our website, askhospiceexperts.org, and this presentation will be added to our video library as well. Today, Daryl Cady will be presenting how to choose the best hospice for yourself and your family. When you have been told by a physician or healthcare team that hospice care would be beneficial at this time, how do you decide which hospice provider to choose? In today's presentation, Daryl Cady, CEO of Hospice of Southern Maine, will discuss some of the factors to consider when making this important decision. Daryl has led Hospice of Southern Maine since 2014. Prior to coming here, she served as the CFO at Home Health and Hospice Care in Merrimack, New Hampshire. Daryl has strong financial, clinical, and operational acumen and a strong personal interest in end-of-life care. When asked about doing something new or unconventional, she's known for saying, "Why wouldn't we do that, especially if it benefits patient care?" From the top down, this idea has permeated the culture at Hospice of Southern Maine, where we try to anticipate patient needs and provide the best possible experience for them and their loved ones as they navigate this important stage of life. It's my pleasure to introduce Daryl as she guides us on choosing the best hospice provider.
Thank you, Kim. I am delighted to be here today to guide our listeners in how to choose a hospice provider. Whether you're attending this simply to learn more about hospice in general, or to help guide family or friends currently considering hospice care, we welcome you and your questions. This is an important end-of-life decision. While many people think hospice is just for the last few days or weeks, people can actually begin receiving the benefit of hospice when their prognosis is 6 months. Coming onto hospice sooner rather than later allows you to get the most benefit from our services, and studies have shown that people who choose hospice can live longer with a better quality of life. The goal of hospice care is to improve quality of life by providing compassion, care, and comfort, and making this stage of life as meaningful as possible. As part of that goal, our hospice team supports the patient and family so that they can spend more time together on the things that matter most. At the center of hospice care is the belief that each of us has the opportunity and right to die with dignity, free of pain and other distressing symptoms, to connect with those that we love in meaningful ways, and to know that our loved ones will be assured of ongoing support from a professional hospice team. Deciding which hospice program is the best one to care for your loved ones is just as important as choosing to use hospice. While all hospice programs must meet certain regulations to be certified by Medicare, these regulations may be interpreted differently from program to program. I hope my presentation will help guide you in your decision. So how do you choose the best hospice agency out of the many that may be available to you? I'm sure it'll seem like a daunting task. I'll try to simplify this for you and break it down into a manageable process, and then we'll follow up with some helpful tools. First, I'll go over the basic bare minimum requirements any hospice agency must meet. I'm going to call that the baseline. Then I'm going to walk you through some important differentiators to look for, those things that set a hospice agency apart and make them the best choice for you and your family. So let's begin by looking at the basic requirements for any hospice, again, the baseline. The requirements that all hospices must provide by law begin with a focus on comfort and not a cure. Individuals must forego curative treatment since Medicare won't pay for curative treatments and hospice care concurrently. Hospice care is provided by an interdisciplinary team, which I'll refer to as the IDT team or team going forward. The IDT team is a group of specially trained professionals, physicians, nurse practitioners, nurses, social workers, chaplains, hospice aides, volunteers, and bereavement counselors, all who provide care for the whole person, including physical, emotional, social, and spiritual needs. They all offer volunteer services. Again, all hospice programs must incorporate volunteer services into their daily patient care to keep the volunteer-based essence of hospice as it originated in the United States. And all hospices must meet other needs as well. So in addition to IDT visits, additional services such as medications, durable medical equipment, like a hospital bed for comfort at home, supplies like bandages, lotions, etc., grief counseling, and 24-hour phone support must all be part of the hospice's care package. And hospice care is provided wherever the patient lives. So whether it's in a home, a nursing facility, assisted living facility, or wherever the patient calls home, hospice must come to you. Also, counseling and support for family caregivers. Caregivers can receive training on how to care for their loved ones. In addition, emotional and spiritual support from a social worker or a chaplain will be offered. Grief support is required to be offered at no cost for a year after the death of a loved one. And as a side note here, many people think grief only happens after the death, but people often need emotional support for grief leading up to a loved one's death. And we call that anticipatory grief. And social workers and other care team members can help with that as well. And the patient has the right to stop hospice services at any point for any reason, including if a new curative treatment becomes available for an illness. So you may be asking, if the basic required hospice services are all the same, how do I choose one agency over another? Well, just like with any business, there are also differences between hospice agencies. In the next few slides, I'll lay out the questions to help you ultimately decide what makes a particular agency the best choice for you. And don't worry about writing any of this down. After the webinar, we'll send you a list of these questions, the Care Compare website, and any other helpful resources. So let's start with questions about their scope of services. A lot of these are questions you'll be able to answer with a quick look at a website. But if you don't get your answers there, I encourage you to call the agency directly. And you can you can ask questions such as these. What towns do they serve? Do they have a hospice house? And if not, where would inpatient or respite care be provided if needed? Is there sole focus hospice? Or do they do general home care or other things? And how many patients does that agency currently care for? Now, of course, you'd want to eliminate any hospice that may not serve their area. So their service area map should be easy to find on their website, or again, you can just give them a call. And having a hospice house may be very important because that is where patients and their families can go for 24/7 inpatient care if pain and symptoms are no longer able to be managed at home. If the person's symptoms cannot be managed at home, you'll want to understand where that hospice will care for you. Very few hospices run inpatient facilities because they're expensive to run and they're a challenge to staff. In Maine, I'm aware of 3 hospice houses. Our hospice house, the Gosnell Memorial Hospice House in Scarborough, one in Lewiston, and one in Rockland. And if you haven't been in a hospice house, it may be hard to envision or understand why they're so important. Now, I can't speak for all of them, but Gosnell is a home-like setting with a kitchen and a dining room and a living room with a fireplace, a beautiful patio and gardens. It has 18 very private, spacious suites with modern amenities like a microwave, refrigerator, bathroom, comfy recliners, pull-out sofas, and even air mattresses for large families. So as you're hearing this, you may be getting a picture in your mind and understanding that this space is not just for patients. And it really underscores that in hospice care, we're all about comfort and support for the patient and their family and their friends by creating a conducive environment for people to be together. And Gosnell's doors are open to anyone needing acute hospice care, regardless of insurance coverage or ability to pay. Our nurse practitioners, nurses, hospice aides, social workers, and physicians provide high quality healthcare around the clock. There's a dedicated chaplain, a cook, and lots of extras like free cookies, muffins, and coffee. We also provide our Paw Prints therapy dog program, Heartstrings live music, and Reiki energy. If the hospice you're considering does not have a hospice house, you should ask where they'll provide the patient's acute care or respite stays for caregivers if a break is needed. You also want to ask if they only do hospice or if they provide other types of care like home health. This is important because while it may seem like having other lines of business is a strength, in my experience, a hospice that only does hospice attracts certified experts, has the most experience, and tends to be the go-to in that area. At Hospice of Southern Maine, we only focus on hospice care. It's all we do. It's our passion to provide the best possible hospice care at end of life. And lastly, ask how many patients they're caring for. That'll give you a sense of their bandwidth or professional capacity to provide high quality care. For example, if you're considering a hospice that only has, say, maybe 15 or 20 patients, they may not be well staffed or experienced, and you may not get the right amount of support when you need it. Just to give you a frame of reference again, Hospice of Southern Maine is the largest hospice-only provider in Maine. We care for about 220 patients across 68 towns and islands in York and Cumberland counties. To do this, we employ 150 people, and more than half of our employees are either registered nurses, nurse practitioners, or certified nursing assistants, CNAs. We also have about 120 volunteers helping us as well. So next, you want to ask them some questions about their business. Where is their agency's local office? Where is their headquarters? Are they a nonprofit or a for-profit? How long have they been in business? And what do I do if I'm unhappy with service from the agency? So why is being local important? In a word, accessibility. For example, I am the CEO of a local hospice, and I'm sitting here right on Route 1 in Scarborough. I'm right next to the Holy Donut. And if you have a question, you can stop in. And if you have a problem, not that we expect you will, you can call me. Our hospice house is just up the road. As the CEO of Hospice of Southern Maine, I live and work in the same community as our patients. Our employees, our leadership team, our board members and volunteers are your neighbors and friends. We are local and we are accessible. That may not be the case for another agency you're considering in the area. They could be part of a large healthcare system, which may even be out of state. Where does their CEO live and work? Do you even know who their CEO is? Choosing a local hospice where decisions are made by local management may improve your hospice experience. We've heard stories of hospice nurses recommending a certain therapy for a patient, but the decision to provide that treatment may need to be made by the company's out-of-state headquarters. This may delay treatment for the patient and leave them, their family, and their nurse in limbo, waiting until this therapy may or may not be approved. When you're doing your research, you'll see that each agency's status for the for-profit or nonprofit is usually listed. Again, why is this important? The big difference here, of course, is that a for-profit's main purpose is to generate profit, while a nonprofit's work is to fulfill a mission dedicated to a social cause, like improving the community's health or providing a basic human need. Another upside of choosing a nonprofit is that a nonprofit can receive charitable donations that allow them to provide certain services when others can't or won't. For example, Hospice of Southern Maine is a nonprofit. You heard Kim say earlier that I like to say, why wouldn't we do that? If it's in the best interest for the patient and their family, we will and we do. For-profit agencies may make decisions based on their bottom line. Charitable donations also allow us to provide hospice services to everyone in our community, regardless of their ability to pay or insurance coverage. And I am very proud that we received the 2018 Purple Street Community Partner Award for caring for 10 of their homeless clients. One of them lived in his car in the Walmart parking lot, and another one lived under a bridge. Asking how long a hospice agency has been in business will also give you important insight into their business, and most importantly, about their experience. It will tell you a lot about their leadership, strengthen their community relationships, and financial health. Hospice of Southern Maine has been providing hospice services in our community for over 18 years. Our board is made up of local hospitals, members, business leaders, physicians, and others who take their responsibility to our community very seriously. So next, perhaps you want to ask questions about what you can expect for day-to-day care. Are their staff members specially trained and certified in hospice care? How do they support the family and caregivers? How often will the nurse visit? And what happens if I call after hours? Hospice work is very different than working with people who have an illness from which they'll recover. Specialized training programs are offered for nurses, nursing aides, chaplains, social workers that help them understand the unique patient and family needs at end of life. Inquire as to how many staff members have this advanced specialized training. If a considerable number have specialized in hospice care, this shows that the agency is committed to and passionate about hospice care, and the staff is committed to supporting the patient as best as possible. Again, I can't speak for other hospices, but at Hospice of Southern Maine, for example, our physicians and nurse practitioners are all specialized in hospice and palliative care. And many of our 150 other employees have specialized certifications and advanced training in hospice as well. So moving on to quality, you would want to ask questions about the quality of their care. What are their unbiased scores on how well they support the patient, how well they support the caregiver, how well did they manage pain, and what percentage of their caregivers would recommend them? So this is where you can find this information out on Care Compare in their website, and I urge you to go look for yourself. Some of the data comes directly from the hospice's medical records, and some comes from surveys from family caregivers. Caregivers are asked things like, was the service timely? And was the patient treated with dignity and respect? Among many other questions. I am very proud of our scores. We consistently meet or exceed the national benchmark in all quality metrics, and nearly 98% of caregivers say they would recommend us to family or friends. And we are very excited to be the only hospice in Maine to receive the Hospice Honors Award for these scores. So what else sets the best apart? This last set of questions will now help you move to the next level in determining what it means to be the best of the best. So consider asking them these questions. How do you feel your agency sets itself apart from other hospice agencies? What care and services does your hospice provide above and beyond the basic? What is your agency's philosophy of care? Does your agency give back to the community, and if so, how? And does your agency have a commitment to sustainability? You may have other questions too that are especially important for you, like, can your cat or dog visit you at the hospice house, and do they have chocolate ice cream? Seriously though, I know what we would say if you called. And I know also that our employees are particularly proud of our high quality and what we call our expanded philosophy of care. As well as reputation, additional services, geographical area, and other considerations we've discussed, it's important to understand each agency's philosophy of care. Just like each patient is unique, each agency's approach to care is unique, and Hospice of Southern Maine has an expanded philosophy of care. In the past, people with special medical circumstances may have been denied hospice because some of their healthcare treatments were considered curative and weren't allowed by Medicare. For example, someone receiving dialysis, palliative radiation or chemotherapy, IV fluids, or using a ventilator or feeding tube may not have been a candidate for hospice. But Hospice of Southern Maine has expanded its philosophy of care, so we say yes to patients in these situations. Of course, these determinations are made on a case-by-case basis and should align with the patient's goals of care. But we have helped a lot of people who might not otherwise have been eligible for hospice. And I'd like to share a story to help illustrate this and one that always stayed with me. A few years ago, a 50-ish-year-old mom came on hospice with us. Her primary diagnosis was end-stage renal disease or kidney failure. When discussing her goals of care, she said that she wanted to see her daughter be married in the fall. We wanted that for her too. We reached out to a dialysis company and working together, contracted with them to provide palliative dialysis. This allowed her to attend her daughter's wedding in October. Now, of course, October is very close to November and December, which is also Thanksgiving and Christmas. So after the wedding, we reevaluated with her, of course, her goals of care, and we extended her palliative dialysis treatments by a few weeks. As her disease progressed, she, along with her family and her providers, made the decision to discontinue her dialysis the week of Christmas. She died peacefully about 2 weeks after the holiday. The beautiful gifts she and her family received by attending her daughter's wedding and spending the holidays together were amazing. And it leads us right back to what we said earlier. If we can do something to meet the needs of the patient and their family, why wouldn't we do that? As I said, this is one of our important extras, and it's not always reimbursed by Medicare or insurance. So this is where our community generosity comes in. Each year, we need about $300,000 for the free and charity care we provide, and this is 100% supported by donations. And lastly, I encourage you to ask how they give back to the community and how they protect the environment. These are the extras that speak to the agency's true values and long-term vision. I can give you examples of how an agency might give back, but these are just some of the things we do. We hold meaningful community events and provide educational opportunities. We educate other healthcare providers on end of life. We work with college students. We provide free grief support to local businesses who have lost an employee. And we use 100% solar energy for our buildings. So I know that this was a lot of information, and I hope that I've given you some ways to differentiate between hospice agencies you may have to consider in the future. And after the webinar ends, we will email everyone a list of the questions I shared, the Care Compare website, and any other information that you'll find helpful for your search. I invite anyone who is considering hospice care in our area to call me with any questions you may still have after this webinar. Thank you.
Thank you, Daryl. That was great. It's really, truly amazing when you drill down into it, how many ways hospices can set themselves apart. You provided some great information today, and I'm sure it's going to be helpful to anyone seeking hospice care. The questions that are on the screen now are the questions that were submitted when people signed up for the webinar. And we wanted to put them all here. But the first three questions: how do you know what each hospice does, or are they all alike? How does a hospice provider address the family's emotional needs? And who are the different persons and disciplines on the hospice team? We feel like those have all been answered in your presentation, Daryl. So we're going to begin with this question. If you have problems with a hospice, can you switch?
Yes, you can. If you're not happy with your hospice care for any reason, you can revoke the agreement that you have with your current provider and begin with another. It's always your choice to start or stop hospice and to work with an agency that provides the services that you deserve. And then we had another question. We actually had two questions that came up. The first one being, does Hospice of Southern Maine support Maine's Death with Dignity law? And then there was another question that followed on that was about VSED, which is voluntary stopping of eating and drinking. So I'm going to take the first one, which is Maine's Death with Dignity law first. So often a person may come on hospice already having had a death with dignity conversation with their attending physician. And I'm going to say I'm not certain how or what other agencies do with respect to death with dignity, but I can say with certainty that Hospice of Southern Maine thought about it very seriously back in 2019 when it became law. And I think for many patients, it comes down to nearly the same thing as many say about hospice. It's not about giving up, it's about taking charge. And Death with Dignity gives patients the chance to make informed decisions about end of life. And what we have found with many is that they just want to be informed and have control over their options. So kind of with that backdrop a little bit, how are we involved? So kind of unlike hospice, where we're actively involved in the patient's care, frequently, with Death with Dignity, we're not involved in the act itself. So I'll get to that in a little bit. But like with hospice, where we support the patients and their families throughout, we are there to support them before and after. So what do I mean by that? Our agency physicians cannot participate in the act. We cannot be present during ingestion of medications, and a patient cannot ingest medications at God's Now. So it's actually called limited participation for the agency itself. But should something not go as planned, if a patient does ingest their medications at home, we would transfer a patient to God's Now if the need should arise. So that's kind of a 30,000 foot level of our policy. And so about a year after the policy was in place and having some time with the new law, we did check in with all the employees who had had experiences with patients to ask if we had the right policy in place. We did several, in fact, debriefs with the employees, and they agreed that we did have the right policy in place. So we have kept things as they were since the law was enacted, and we do continue to evaluate. We do continue to debrief. We have employee sessions frequently to talk about it. But since we put the policy and the law became effective, we have not made any changes. So moving on to VSED, which again stands for voluntary stopping of eating and drinking. So I will say that when Death with Dignity became law, VSED became a much more rarely discussed topic. However, if an individual does choose to pursue VSED, they would have a discussion with our medical director and of course their care team to discuss various criteria, such as the patient's prognosis, the decision-making capacity, which would include psychosocial and spiritual health. There would be significant involvement of the family, discussion of other palliative options and risks. VSED is quite different than Death with Dignity in that it could take days to weeks for death to occur. So of course you would want to have significant conversations about that. And I think kind of the last thing to note on this is it's important to note that a person who chooses VSED can change their mind at any time should they choose that path.
Thanks, Daryl, for that. That was a really thorough covering of those issues. Our final question today is, how do you see the role of physical therapy in hospice?
Sure. The role of PT is to help provide additional training and support to the patient and family, usually for a short period of time. Physical therapists are especially trained to assess patients' mobility and safety more than nurses are. So having them able to make a few visits to see the patient and family and assure that we as a team are doing what is best and safest for the patient is really important to all of us. So it's often just a few visits with training again for the family, allows them to be better able to care for the patients overall. So the nursing goals are centered around the patient, and PT oftentimes is with the patient, is better able to determine, quality of life, which allows the nursing to do what they do, and PT to focus on what I mentioned, which was patient mobility and safety, more than the nurses are.
Wonderful. Thank you so much, Daryl, for this wonderful presentation. Thank you, everyone, for joining us, and check your email boxes later today. We will send you out the list of information that we mentioned. And if you have any questions for us, please don't hesitate to call. Thank you so much.